In early part of my presentation, you heard what the young people had to say, and now let us see what the medical profession says. I have got some slide which is produced by Dr. Kashi. He cannot be with us, but as you can see from his very first slide, World Health Organization considers that 90% of children breathe toxic air, and obviously that is serious and should be taken seriously. And if you look at the report by Public Health England, which says air pollution poses the greatest environmental threat to health, responsible for 8.8 million premature deaths per year globally. In the UK, 36,000 deaths a year are attributed to man-made pollution, and 5% of the deaths are due to poor air quality in England in its region. If you look at the Midlands, we are talking about 10%. That's a proportion of deaths attributable to air pollution in the region. And it is not just the respiratory system, but eyes, nose, throat, heart, blood vessels, brain, reproductive systems, and as I mentioned, our brain. So these are some of the knowns, but there are a lot of unknowns and unknown unknowns. But what worries me is the very small particulate matter, which is about 0.1 of a micron, and that penetrates through our skin to our brain, and the damage could be severe. And this goes throughout from pregnancy to our childhood, adulthood, and when we are older, the impacts are huge on our health. I have listed some of these illnesses and ailments. If you look at, for instance, this diagram, which is about particulate matter and projections in the 30 years, the projections are serious. It means things are going to get much worse. But at the moment, the strongest evidence for impact on health is associated with particulate matter 2.5. Each 5 micron per meter cube increase in PM 2.5 leads to a 7% increase in mortality. And the smaller the particle, the greatest risk to health, as these have greater chance of being thrown deeper into our body. If you look at the nitrogen oxide, which government is very concerned, over 1,140,000 new cases of disease are attributed to nitrogen oxides. And ammonia, obviously, is a cause for concern. As I said earlier, the way we farm has to change. Sulfur oxides are a cause for concern, but their emissions have increased by 66% and in recent years, and we know we are working on means to reduce it even further. The most worrying thing is volatile organic compounds and ozone and some non-methane voltaic organic compounds, which can be carcinogenic and so on. We know if we reduce pollution in the air, the benefits can be huge. And one way that we can do that, for instance, in terms of transportation, these are the diagrams we are presenting in London on 28th and 29th of October, pre-COP26 by instrument mechanical engineers. If you look at, if we can somehow convince people rather than using cars to go onto rails, or walking or bicycle, that could help. We hope the government would electrify the rest of the rail and expand it, because that's the future. And also, I know, for instance, Warwick District Council and Coventry have produced map of cycle routes, which very similar to London Underground maps, and that helps people to know that they can go from A to B, B to C, and so on. So the whole thing is interconnected, and they are developing it, so that's a good thing. C4FF has been producing a lot of good work for so many years. For 40 years, we have been into developing systems for manufacturing and also for transportation. We're very involved in designing green machines. And as I explained, I personally believe it is wrong by government to stop, to ban hybrid cars. Most Japanese manufacturers, Toyota, a leader auto manufacturer, has gone for hybrid. Hybrid is the future, and it will set the system for the all-electric future in the future. And we should basically